Welcome back to Daniyal Ultrasound Clinic. This is Dr. Munir Abasi. Today we have got an interesting topic, that is appendicular lump with two fecoliths or appendicoliths with no signs of rupture. This is an interesting topic. So on today's ultrasound, we can see here the findings consistent with an appendicular lump in the right lower quadrant of abdomen at the ileocecal region. Here, let me first describe that appendix appears enlarged and thick-walled with surrounding echogenic inflammatory fat, which indicates periappendicular inflammation. And within the appendicular lumen, there are two echogenic foci here, you see. First of all, let me show you in the real time. Here, this is the appendicular lumen, which is showing hypoechogenic area. Here is the echogenic focus, another one is here. This is the proximal end, this is the lower end. So, within the appendicular lumen, two echogenic foci with posterior acoustic shadowing are visualized now. One at the proximal end, as I told you, another one is at the distal tip of the appendix. These represent actually appendicoliths, also known as fecoliths. They are hard calcified masses of inspissated fecal material. Importantly, there are no signs of rupture or perforation. Patient is lucky enough. However, the appendicular wall remains intact instead of the impacted fecoliths. No periappendicular collection so far, no free fluid and no air foci are visualized. Now let's understand what these findings mean in simple terms. An appendicular lump forms when an inflammatory or inflamed appendix adheres to surrounding bowel loops and omentum. This is the actually body's natural defense mechanism or response, which tries to wall off the infection to prevent spread of pus or perforation. That's why we call peritoneum as a guard of the abdomen. Guard, G-A-U-R-D, guard. So instead of the free abscess or peritonitis, we got this localized mass in the right iliac fossa, which we call it appendicular lump. Now, in this case, the presence of two fecoliths, one near the base and the other one at the tip, that tells us that appendix is obstructed or there's a obstruction at both ends. So the cause is this may raise intraluminal pressure and leading to congestion, wall thickening, and localized inflammation. But fortunately, here there is no sign of rupture. This is the transfer section I show you. This is like a cystic space in transverse section, and when we take its longitudinal section, it's elongated sausage shaped or tubular structure which is containing these foci. So this was an interesting case. That's why I wanted to share this. Now, actually, one more thing I would like to share here, that why these fecoliths are important, why they matter. Actually, the presence of fecoliths is very significant because it is a primary cause of obstruction in most cases of appendicitis. In both proximal and distal parts, they are both blocked. The trapped secretions cannot escape. This increases pressure and may eventually cause perforation if it remains untreated. So, the timely diagnosis is crucial. Patient has to undergo operative procedure so as to remove the appendix, and this was the main reason that this is the transfer section in which both appendicular lumen as well as this appendicolith is visualized, and this is the longitudinal section which is taken for the surgeon to understand or give its proof. So thank you very much again.